Hello and welcome to a virtual debate on integrative oncology, the missing link in Europe's Beating Cancer plan. A media partnership between Euractiv and Boiron, one of the leading companies putting homeopathic medicine at the forefront of healthcare. I'm Mariam Zaidi and I'll be your host over the next 1.5 hours. And to everyone who is, of course, joining us online, thank you so much for being here with us. We appreciate you being with us so much. And if you do, of course, have any comments or suggestions or questions for any of our panelists, do put those into our chat page and I'll pick out some of those comments and questions later on in the program. So today we're going to be discussing integrative oncology. It's a holistic approach that puts patient well-being at the heart of cancer treatment and care. It combines both conventional cancer treatments such as chemotherapy, radiation and surgery, but also looks beyond that. It advocates for the use of complementary therapies such as homeopathy, acupuncture, herbal medicine, Ayurvedic medicine, Chinese medicine, in conjunction with, of course, traditional cancer treatment. And proponents say that this approach really does ease the suffering of patients, their symptoms, their side effects, and it can even help with the psychological effects of anyone who is, of course, diagnosed and is undergoing cancer treatment. Now, in November last year, the EU Commission President Ursula von der Leyen, she said that she wants to make cancer treatment and prevention a key part of the EU Commission's Health Action Plan. So Europe's Beating Back Cancer Plan aims to save 3 million European lives by 2030, which the Commission believes is mission possible. Now, we do know that, of course, that the European Parliament is, of course, debating their own draft report and legislation on their cancer action plan, and they are debating over 1,500 amendments at the moment, and they hope that this legislation can really help support national healthcare systems within the European Union. So the question then is complementary and integrative medicine really that missing link in the fight against cancer? Well, to answer that question will, of course, be a group of panelists and experts who, I might add, do fully advocate for it to be integrated into the standard care of treatment for cancer. But first, some introductory remarks from some EU politicians. And first, we're going to go to Spanish MEP from the European People's Party and chair of the Petitions Petty Committee, Dolores Montserrat. Ms. Montserrat, welcome. Now, you've said that Europe has never been more prepared to beat cancer, that it has to intensify efforts to achieve that goal by working together. So what more can be done?
Thank you very much, and I'm so happy to be here with you. Well, the cancer burden is estimated to have risen to 2.7 million new cases and 1.3 million deaths in 2020 in Europe. Cancer is responsible for more than 25% of total death in Europe, and it is the leading cause of death between the ages of 45 and 65, a number increasing every year. The Europe Beating Cancer Plan represents an unprecedented step ahead in the fight to this disease, with a budget of 4 billion euro coming in particular from the new European Union Health Programme, aimed to foster greater cooperation between member states, complementing national cancer plans. The plan will facilitate knowledge sharing and addressing with 10 flagship initiatives for key areas in the fight to beat the disease. So prevention, early diagnosis, and high-quality, innovative, and effective treatment. Third, quality of life for patients, caregivers, and survivors and their families. And four, the equitable access to all the stages of the disease and its cure. No? So one of the most important changes introduced by the plan is the approach to all the phases of the disease, including the quality of life of patients in treatments, but also its post-treatment and the survivorship that, thanks to the most innovative and effective treatments every day, more available, keeps rising. So thinking of quality of life for patients, it is essential to remember that 5 years after cancer, 63% of patients suffer from sequelae, 50 are limited in their physical activity, and 48 suffers from fatigue. So patients are looking for therapeutic solutions to the side effects and the sequelae of their disease and their treatments. They find these solutions also in integrative oncology performed by healthcare professionals, which seeks to optimize health, biological conditions, quality of life, and clinical outcomes throughout the cancer process, supporting and respecting conventional treatment. So integrative oncology shows scientific-based impact through greater resilience to disease and cancer treatment, greater well-being, longer life expectancy, decreasing relapse. So as I say, the Europe's Beating Cancer Plan for the first time integrates the quality of patients' life pillar, and the Becker Committee report we're working on in the Parliament address it in various paragraphs. The speed that there is no mention to integrative oncology in the European Beating Cancer Plan, nor in the first draft of the Becker report, but I have draft amendments in this direction in the report of the Becker Committee, and I will do all I can to clearly include integrative oncology in the final text that will accompany the Commission implementation of the European Beating Cancer Plan. To highlight the importance of complementary medicine and integrative oncology, this week the Parliament host 2 events to promote complementary integrative medicines. One was organized by the Health Working Group of the ENVI Commission, which I co-chair. In the Pharmaceutical Strategy for Europe report, for which I have been the rapporteur, we achieved to include a paragraph that highlights the need to foster and support complementary integrative medicine. So these are small, great steps in the right direction to effectively improve the quality of life of all the European citizens. So let's keep working together to reach that goal. Thank you.
It is a work in progress, but important legislation by the European Parliament. Let's now go to Swedish member of the European Committee of the Regions, and she is also their author on their action plan for beating cancer. Birgitte Sekreder, welcome to you. Now, Ms. Sekreder, you of course advocate for a regional approach. I mean, you are a member of the European Committee of the Regions, after all, when it comes to cancer prevention and care. And you say that by doing so, Europe can remove the disparities between care and treatment. So tell us more about how the regional approach differs.
Well, it depends. For example, in Sweden, the regions are responsible for the hospitals and healthcare. So, of course, we feel very much involved. And to get a better knowledge, we have formed 6 cancer centers in Sweden. And these 6 cancer centers work together. And I think this is really, really good. And my wish is that maybe we could have a cancer center on EU level to collect knowledge and research, and especially when it comes to complementary and alternative medicine, because more and more people are asking for this. In Sweden, is 1 out of 4 who use complementary medicine. So this is what is so important for the future, that we try, as the former speaker said, that good healthy lifestyles, so the side effects can diminish, because we have many survivors from cancer and they really need to have a good life. And the quality of a good life, there we can do some more research, what is evidence-based, have this approach. For example, prayers, mindfulness, yoga, healing, and also for natural medicine, we need to know how they interact with each other, with other medicine, traditional medicines. So the most important is that we have this cancer knowledge centers, so it will be reached out in local level. So the nurses and doctors, the health professionals knows about it also on local level, so they can deal with the people. And I think also that you were talking about fundings. I think also we must improve this research and fundings. So the research together with the natural medicine and implementary medicine work together with the traditional, and education and information we need. And then maybe we should have also multidisciplinary working groups working together. But one attitude question is that cancer patients should feel free to have a dialogue with the health professionals about complementary medicine, because sometimes that is not the case. They are afraid to say something that they are using this. But I think in the future, the dialogue between the cancer patients and the medical caretakers should be more open so they can discuss the complementary and alternative medicine can. Thank you.
Okay, thank you so much, Ms. Brigitte Sacre-Deux. Also, of course, for shining a light there on the specific treatment available at a regional level, and for saying that there needs to be perhaps a better dialogue between the patient and the care provided. Thank you so much to you both. Right, well, over now to our panelists. We have clinician Professor Michael Fraas. Welcome to you. We have Dr. Elia Rossi, a general practitioner. We also have Eric Bulins, a patient representative from Belgium, and Anne-Laure Leclerc, a representative from Boiron. Thank you all for joining. It's a pleasure to see you all, albeit virtually. I think, of course, for everyone who is joining, that any, debates or conversation about cancer care and treatment is always one that's worth having. And of course, to understand who our panelists are, what they advocate for, what they're passionate about, they will now be given 5 minutes to talk on what they want to present. So first of all, we're going to go to Professor Michael Fraas, who's MD at the Medical University of Austria. He's also authored a study on homeopathy treatments for patients with lung cancer. Professor, you now have 5 minutes. Please go ahead.
Thank you very much for the invitation. I am very, very happy to talk about cancer patients. I have treated cancer patients 15 years during my work at the Medical University of Vienna. And a colleague found that her patients treated with homeopathy had a better prognosis and a better life quality. So I will show you with the next slide the results and the indications of our study. The main question was to find out whether or not a homeopathic additive treatment, in addition to complementary treatments such as chemotherapy, radiation therapy, and or surgical therapy, might help to improve life quality and to prolong survival with patients with advanced lung cancer. It was a phase 3 prospective study, and it was a computerized double-blind randomization. So randomization was in a very high standard, and this also influenced the quality of the study. 4 cancer centers were included, and in addition, we also had a new way to define exactly the time of recruitment of the patient, because they had to be diagnosed within the last 8 weeks. And as already explained, all these patients were undergoing chemotherapy plus minus radiation therapy. Next slide. Now, the study design included altogether 150 patients with advanced stages of non-small lung cancer. 51 patients were included, double-blind, and randomized into the homeopathy group. They received conventional treatment and, in addition, individualized homeopathic treatment, while 47 patients exclude the possible influence of a homeopath on the patients and on their outcome parameters. We also created a third group, a so-called control group. Those patients received only conventional treatment that were not investigated regarding life quality, just with regard to survival. So the 98 patients of the homeopathy and placebo group were evaluated with with regard to life quality as well as to survival. Now, the evaluation of patients' quality of life was done by two very old known questionnaires. One is the questionnaire of the European Organization for Research and Treatment of Cancer, the EORTC questionnaire, which is focusing on quality of life, especially in patients with cancer, and the short form 36 questionnaire, which evaluates patients' quality of life with all types of pathology. And two questionnaires were filled in at the study entry and then in the 9th and 18th week after beginning of homeopathic treatment. Next slide. Now, the primary endpoint was evaluation of patients' quality of life, which means the homeopathy group versus placebo group, and the parameters improved after 9 weeks, 10 out of 14, while after 18 weeks, all 14 parameters improved in the homeopathy group when compared to the placebo group. And this was significant between the two groups in favor of homeopathy. Next slide, please. If you look to the primary endpoint, for example, pain and nausea were improved by 78%, while fatigue by 75%, appetite loss by 71%, and insomnia by 67%. All these reductions were significant, evaluated. Next slide. If you look to this so-called Kaplan-Meier plot, which evaluates patients' survival in all these three groups, you see that the upper curve is the homeopathy group. There were most of the survivors, and there was a significant improvement of the survival rate when compared to the placebo group. The homeopathy group had a 45% survival, the placebo group 23%, and the control group 13%. And the difference between the homeopathy and placebo group, as well as between homeopathy group and control group, was statistically significant. So this was really a surprise also for us, and we were very happy to find these results. Next slide. So here you can also see maybe even more drastically the evaluation of patients' survival. The mean survival time was in the homeopathy group 435 days, in the placebo group 257 days, and in the control group 228 days. So it was about 6 months difference between homeopathy and placebo group, and about 7 months between homeopathy and control group. Next slide, please. Now, the survival results could be explained by the improvement of the quality of life and a better observance of conventional treatments by alleviating side effects of, for example, chemotherapy, radiation therapy, and or surgical therapy. And a study of the specific activity of the homeopathic treatment would be warranted. Thank you so much for your attention.
Thank you, Professor Faraz, and thank you, of course, for sharing your research and, of course, for highlighting quality of life of patients. Now, next to Dr. Elio Rossi, he's the Director of Complementary Medicine and Diet in Oncology at the Campo di Marte Provincial Hospital of Lucca, Italy. Now, he says we must meet the unmet needs of cancer patients when it also comes to quality of life. Dr. Rossi, welcome, and you have 5 minutes.
Yes, thank you very much. And the slide, please. The slide. Okay. Good afternoon to everybody. Thanks a lot for this opportunity. Next slide, please. As you probably know, around 40% of cancer patients in Europe use complementary medicine. In 2011, the region of Tuscany was included in the Joint Action European Partnership Against Cancer, EPAC, promoted by the European Commission with the aim to map cancer centers that provide integrative oncology across Europe. We found that 47% of responders to the questionnaire and 20% of the total provided integrative oncology treatment. Please, next slide. As you can see, the first graph in the slide shows the increase of integrative oncology centers in Europe since 2000 over the years. And you can see also in the second graph that the complementary medicine more frequently provided to the cancer patient, which are acupuncture, homeopathy, herbal medicine, and anthroposophic medicine. Please, the next slide. In 2013, a public clinic of integrative oncology was set up in the public hospital Campo di Marte of Lucca, my town in Italy. Patient access to the clinic is free of charge, and so are the acupuncture treatments. The aim of the clinic is to improve the quality of life of cancer patients by reducing the side effect of anti-cancer treatment. We provide in our clinic diet advice and qualified information about evidence-based indication of complementary medicine and their potential interaction with anti-cancer drug. And we prescribe adapted complementary medicine solution to patients according to the side effect of their cancer. Next slide, please. From September 2013 to December 2020, were seen 645 patients. Today they are 741. Main type of cancer observed are breast cancer, 60%, colon, lung, ovaries, and uterus. 80% of the patients are female, the mean age is 57, 30% of cancer with metastasis, 10% with the cancer relapse, and 87.7% a second cancer. Next slide. The assessment of the intensity and frequency of symptoms before and after complementary treatment is generally measured with a grading system, while specific validated questionnaires are used for particular symptoms. You see in the slide the number of questionnaires generally used. In addition, in an ongoing clinical study in the Tuscany region, to assess the efficacy of complementary medicine in cognitive impairment of breast cancer patient after anti-cancer therapy, so-called chemobrain, we use other several questionnaires and tests. Next slide. We were thus able to demonstrate the effectiveness of the treatment with a statistically significant reduction in the intensity or frequency of a number of symptoms such as they say, we confirm what Professor Frasser said just a few minutes before. Hot flashes, nausea and vomit, constipation, asthenia, anxiety, depression, insomnia, and also mucositis. Finally, we have significant result in reducing the intensity of radiotherapy-induced dermatitis, so-called radiodermatitis. Next slide, please. This important role that complementary integrative medicine can play as a supportive therapy for cancer patients is also recognized by the recently published Breast Cancer Manual by the European Initiative for Breast Cancer, which states that breast unit should have a written policy and discuss the use of complementary integrative medicine within their structure. Next slide. Finally, I want to point out that we are in approval phase of the Tuscan regional guidelines, so-called diagnostic therapeutic assistant pathways, on the use of integrative complementary medicine in oncology. As a Professor General Director of the Regional Institute for Study Prevention and Oncological Network ISPRO of Tuscan region has stated in several occasions, if a complementary treatment demonstrates its efficacy to improve cancer patient clinical condition, along with conventional treatment, of course, complementary therapy, it should be integrated in the public health system to ensure it is made accessible to the highest number of patients. It becomes a claimable right by cancer patients. Thank you for your kind attention, and I remain to your disposition for any question you may have. Thank you.
Thank you, Dr. Rossi, and I'm sure many people have many questions for you too. Moving on to Eric Bulens, he's a patient representative in Belgium for the European Federation of Homeopathic Patients Association. Mr. Bulens, you also have 5 minutes. Please go ahead. Mr. Bulens, if you could possibly unmute yourself, we think there might be a problem with your sound.
Is it better?
Perfect, lovely. Please go ahead. You have 5 minutes.
Fantastic. Sorry. Good afternoon, ladies and gentlemen. As a patient organization, we know that many people undergoing cancer treatment seek complementary therapies to ease the discomfort of chemotherapy and/or radiotherapy. Most of those who have used CIM are satisfied. They say that the complementary therapy has enabled them to lead a more or less normal life. And people at the end of their life were able to maintain their dignity and serenity until they passed away. We, however, note that patients are not always well received in conventional oncology when they express their wish to use a complementary therapy. We do regret that some medical institutions still recommend that their patients avoid complementary therapies during cancer treatment. This may be justified when such a therapy may chemically interfere with conventional treatment. Yet there is no such chemical interaction with acupuncture, osteopathy, hypnotherapy, yoga, relaxation, and regarding homeopathy, the action of homeopathic medicines is not chemical in nature, as fundamental research seems to confirm. We find that quite a few patients use complementary therapies without the knowledge of their oncologist, simply to avoid pressure. And oncologists who don't know about their patients' complementary treatment are often very proud of the results and the little discomfort the patient experiences. Is this a pity or is this just funny? Pro Homeopathia, the Belgian Homeopathic Patients Association, calls on the entire medical sector to be more open, although we admit that the situation is slowly moving in the right direction. The most beautiful manifestation of the scientific spirit is benevolent curiosity towards established phenomena, even if they question the current scientific conceptions. Science is constantly evolving, and integrative medicine illustrates this. A simple request as a conclusion. Just try to imagine how much patients appreciate open-minded practitioners. I thank you very much.
Thank you so much, Mr. Bulens, and thank you also for highlighting the fact that complementary therapy is something that perhaps patients are hiding from their clinicians, and that's something that we will pick up in our discussion a bit later. But finally, let's go to our media partner representative, Anne-Laure Leclerc. She is the Head of Scientific and Medical Affairs at Boiron, who are pushing for more integrative centres dedicated to cancer treatment. Thank you so much for also holding this event with us. You have 5 minutes.
Thank you very much, Mariam, and thank you to all of you experts who gave us a great overview today. Now what I suggest is to take a small step back and to ensure that we all understand what integrative oncology is, and to go back to the basic and to the definition of integrative medicine. Indeed, while this is a very common concept that is perfectly integrated in the US, for instance, where it is fully part of the healthcare system, of academies, of scientific societies, this is still quite a new approach in Europe. Although you already shared many beautiful experiences today, there are no instances, there is no regulation or a very precise definition of what integrative medicine or integrative oncology are. So in a few words, if we had to describe what integrative medicine is, we could say that it brings to patient the best of both worlds, the conventional medicine and the complementary therapies at the service of the patient. Indeed, the patient is really at the center of this model. And what is very important is the coordination. The coordination is key because it means that healthcare professionals and therapists are working together in a multidisciplinary approach to have the best care for the patient. The patient in this model is really considered as a whole person with his emotional, cultural, psychological aspects. And so you can see on this little picture that integrative medicine really embraces conventional medicine, of course, adding to it some specific other very important disciplines of health, such as nutrition, physical activity, body and mind therapies, herbal medicines, and traditional healers such as homeopathy or acupuncture. And there are, of course, many other approaches. These are just some examples. And when we look at this model, what we can say that it perfectly answers to the basic definition of health that the World Health Organization has given us. What is health? It's not only the absence of disease or infirmity, but it's a state of complete physical, mental, and social well-being. And here we get closer to bringing a better health with integrative medicine. And so if you go to the next slide, when we define integrative medicine, we should absolutely not forget some fundamental pillars, essential aspects of it that are fully part of its own definition. Within integrative medicine, prevention is extremely important. Also, patients have an individualized care, meaning that two patients with the same disease might actually not get the same care pathway. So this is really a personalized approach. And within integrative oncology, patients are really involved actively in the management of their health. And when we look at these pillars, this also explains why us, Laboratoire Boiron, as a pharmaceutical company, we are fully aligned with this vision of medicine. And this is the medicine of the future, according to us. We are fully aligned with all these values. We develop some safe healthcare solutions, such as homeopathy, which aim to really help patients get a better quality of life, and which helps patients to go through severe and chronic diseases such as cancer. And so this is why we take it as a mission to help integrative oncology spread throughout Europe. And we really try to raise awareness like we are doing today. And we are so happy that you could hear some very interesting experiences from healthcare professionals and from a patient representative. We also support advancing knowledge, for instance, through qualitative research on integrative oncology. And we try to support some initiatives because new initiatives, and this is what is wonderful, are emerging in Europe. Slowly but surely, we can see more and more integrative approaches and centers. And at Boiron, we try to make the most to support these initiatives. So this was a little bit of theory after all the practical sharing. And I think now it's time for a debate, and we are really happy to hear some questions and participate to this great discussion around such a fascinating topic. Thank you.
Thank you so much, Ms. Leclerc. And of course, it was, I think, really important there that you really did inform the viewers who are perhaps not fully aware of what integrative oncology is, and you've sort of put it very concretely to them. So thank you so much for that. And talking of our viewers, we do need more of your questions, so do put it into our chat page. And please also do perhaps tell us who you'd like to answer those questions that you do, of course, have for the panelists. Okay, right. Well, as Ms. Leclerc was saying, it is now time to open the debate section. And so starting with Dr. Rossi, I'll come to you first. Is the Europe's Beating Cancer Plan ambitious enough when legislation focuses on detection and prevention rather than improving quality of life, what you advocate for?
Yes, of course, it's not. I mean, that this is a wanting of some very important element, which is quality of life of the patient. Of course, prevention is very important, but we have to agree about what we speak about prevention. If we consider it a sort of screening, well, very important, but prevention is to act on the environment, act through the diet and so agriculture and what the industries are doing in the environment. This is the real cancer prevention, to work on these steps. Quality of life is has an impact, very important impact on the compliance of therapy, which is directly connected to the survival of the patient. If the patient can have a good compliance with the anti-cancer therapy, has more chance to survive. And so it's not a small thing. And then there is some phenomenon which was already mentioned about the so-called the long survivors, which have much to deal with quality of life. And this is very important to have, to do what is possible to do to insert this element within the European plan for cancer. Something has been done, but it's just a little bit thing.
Sure, no, and definitely you're right there. Professor Faust, maybe you could pick up on what Dr. Rossi was saying there, that really the EU's action plan isn't enough when it comes to improving quality of life. Is there anything you'd like to add to that first question?
I think the problem in Austria is that the public health system does not support homeopathic treatment or add-on treatment. While, for example, in France, there's SCHISO, which provides supportive homeopathic treatment in oncological patients, as organized and initiated by Dr. Jean-Léonel Barbeau in Strasbourg. And I think we have to work very much, because what some insurances, especially in Germany, have found, additional homeopathic treatment reduces the costs for the insurances themselves, and it also reduces the number of hospital stays radically and statistically significant. So I believe even in oncological patients, this might be an important issue, because in some patients, chemotherapy has to be interrupted because of side effects or adverse effects. And homeopathy has helped in several cases to reduce these side effects and to allow continuation of chemotherapy. And this is very important for these patients.
Brilliant, thank you so much for that. Now over to Mr. Bulens. As a patient representative then, are there still some unmet needs, you would say, for cancer patients? And what then is the benefit of complementary approaches to answering this unmet need?
There are indeed unmet needs. And specifically, it's specifically a matter of attitude, I think. Many patients complain about the attitude of some doctors. You must understand that a patient is ill, so he is to some extent in a minor inferior position towards the practitioner. And there is a tendency of some practitioners to play on that kind of superiority they have because of their job, because of their knowledge, and patients feel very uncomfortable, and very few of them dare to speak up. Now, I can understand that indeed they have a problem to speak up because they are in need and they want solutions, not somebody who is giving lessons and moralizing. This needs to change because I think indeed the oncology complemented with additional therapies can be extremely efficient, but it's also a matter of welcoming patients, and there is still a lot to be done.
No, definitely, and it seems to be a real shame that patients do feel that they can't speak up to their doctors. Dr. Rossi, back to you. Now, you mentioned the growing development of integrative oncology models throughout Europe, but we are still sort of far away from a US model, which considers the integrative approach as fundamental and the basis of any cancer model care. So why aren't complementary approaches better integrated within the European system? Do we need more integrative centres, whether they're public or private, perhaps?
Yes, Mariam, there is a big difference between European situation and the USA situation. There are in the USA a lot of centers connected together in what is called a consortium of a university providing complementary medicine education, and many of them also clinical service, and especially in oncology. But there is a very big difference because in our continent, in Europe, many of the patients, the country are with the national health care system. So it's in United States, all the treatments are paid by the patient at different level. There is insurance, but in general they are private. In our situation, our problem is how to insert this service, complementary medicine in oncology, the gate in a public health service. The gate of access is evidence-based medicine, of course, but it's not so easy. There are different levels of evidence according to the different complementary medicine. But the problem for me is also that the policy level, the stakeholder of political stakeholder level, they are who decide what to insert or not. For instance, in our region, we insert complementary medicine according to this statement. Medicine treatments who have a great diffusion within the population and have a sufficient level of evidence-based medicine, proof of treatment, efficacy of the treatment. But who decide what is sufficient? So we decided that homeopathy, acupuncture, and herbal medicine has this minimum level, and also to be complementary to the oncological treatment is important, because also for the oncologists, because they have the possibility to give to the patient the right level in time, in precise time of chemotherapy, therapy, etc. And also we give in our region acupuncture free of charge for the patient, because we consider that acupuncture has the larger amount of evidence, and so the larger, bigger strength of recommendation.
Okay, thank you, Dr. Rossi. Ms. Leclerc, let's just pick up on some of the points that Dr. Rossi made there. Why do you think there is this lag between the US and the EU when it comes to complementary care? And is he right in saying, pinpointing the fact that policy could actually be the problem in the EU?
Yes, I definitely think that policy has a great role to play in that. And when you speak of the US, we can take the example of the most famous, most important American Society of Cancer, the ASCO, which actually fully endorsed the latest recommendation of the scientific International Oncology, Integrative Oncology Scientific Society, for instance. So it means that a conventional medicine scientific society fully endorsed an integrative oncology recommendation. So far in Europe, we have some very beautiful initiatives, such as the European Society of Integrative Medicine, and also such as learned societies dedicated to specific integrative therapies, such as the ISCO or CISO, about, for instance, what homeopathy can bring to cancer patients. But so far, these are totally disconnected from the conventional, I would say, scientific society world, such as ECO-ESMO or big European representative of cancer guidelines. So definitely, I think in the US at some point, the government decided to have a look at complementary therapies and to bring some funding to make some research and look into the evidence that they could find. And they found the evidence. And this is why now integrative oncology is fully inserted in academies, in anything related to health in the US. I think in Europe, we're still a step behind. But as Elio said, Dr. Rossi said, I think we still can put in place some research program to make things advance in Europe, to be listened by all this more conventional medicine world, and then by also the political world, of course.
Okay, thank you, Ms. Leclerc. Europe's stuck behind. Okay, so Professor France, is a barrier to integrative complementary therapies in cancer care. The potential is basically economic. Is the potential economic burden to patients when it comes to complementary therapies in cancer care one of the main barriers? What would you say?
Yes, I believe it is, because in Austria, the social insurances, which are otherwise very generous, do not support homeopathic treatment unless you can prove that there was no other means of supporting a patient or help in his health condition. So as long as patients were treated in the hospital, and this was very well accepted by patients in the Department of Oncology of the Medical University of Vienna, then it could also be used by patients with a smaller financial potential. And of course, if you are treated by a homeopath in his office, the honorarium may be a burden, or may prevent patients from taking homeopathy. So I believe it should be somewhat similar as what I believe is still possible in Germany, that the insurances allow homeopathic or other complementary therapies. And maybe in the future, I'm just dreaming, we would have the situation as in India, that there's a special ministry for at least 5 complementary therapies, including homeopathy. And what we have heard also from the current situation with Corona, that homeopathic treatment was very, very successful. And I think this should be kept in mind, because as well known, homeopathy has been very helpful during previous epidemics. So we are working, and we try to convince patients and politicians to support the patient, but this is still a long way until acceptance, but we're still optimistic.
Right, and Professor Frass, you've also done, so much research on this issue. Let's talk about the cancer patients in Austria, the ones that you've treated. Are they, or the ones you haven't treated perhaps, are they given complementary approaches via the public health system?
No, the public health system does not support. If you treat a patient and the patient wants to get some reimbursement from the public health system, he gets about 5 to 15 euros. This does not cover the cost of a 90 minutes or even longer history taking of the homeopathy.
Okay, so Mr. Bugulins, there, you heard what Professor Frass said, that patients only get back 5 to 15 euros. That's not a lot, really, is it? So is the cost, the lack of reimbursement there of complementary approaches, an issue that can then prevent patients from getting the most efficient management of their condition?
I don't think so, because you mentioned very low amounts, and indeed the reimbursement is very, very weak, very low. Now, you must say the cost of homeopathy for patients is not excessive, and it will never, I don't think it will ever discourage patients from relying on homeopathy. It is a cheap form of medicine, which doesn't mean that it is low quality, on the contrary, but it is really affordable, and therefore no patient will ever renounce homeopathy just because of money.
Okay, but a follow-up question, Mr. Bugulins, then. What do you think of Dr. Rossi saying that his patients are given free acupuncture? Is that a bigger cost to the system, perhaps? Is that something that could perhaps be integrated across Europe?
Would be nice. Would be nice. The question is, what practitioners would be ready to do so? Yeah. The same holds true for homeopathy and all other CIMs. It would be nice if we could afford it. The question is, who will budget that? I don't know. I don't have the answer.
No, sure. If something is given for free, I'm sure many people would avail of it. Okay, so Dr. Rossi, now we've discussed the cost very specifically about complementary medicine. Now, in your region, as you've spoken about it, you've managed to really effectively reimburse patients for the cost of their integrative care. So how could this become something that is seen more widely across Europe?
Well, in our region, there is no reimbursement, is free access to the visit and to the cycle session of acupuncture. Homeopathy and botanicals, herbal medicine are paid out of the pocket of the patient. But to achieve this result was a process that in our region started more than 20 years ago. Process of integration of complementary medicine, homeopathy within the public health system. You may take in count that in our region, in general in Italy, all the treatment and the diagnosis, test, RX, whatever, for cancer patient is completely free. And so it's a problem to give or to support the patient with other complementary medicine which are paid by the patient. So we achieve this result to have a possibility to give the patient the opportunity to use this kind of therapy. Then you must take in consideration that, as the colleague said before, in representative of the patients, the cost relatively economic of this kind of therapies, and also the approach, we can say, non-pharmacological to the treatment, which means not to add other pharmaceutical product to other important anti-cancer treatment, which are sometimes very toxic for the patient, which means that to give to the patient some chance to be detoxified of the treatment and to have a better compliance. This is a very good result for everybody in our region. And then the last thing I can say that we need, of course, more evidence to insert. But you have to take in account also that every country in Europe has different kind of health national system, and there is insurance like in Germany, there is a very federalistic system like in Italy or in Spain, and there is more centralistic like in France. So it's not easy to find the right solution for each different country in Europe. And finally, I can say that we need to create a very large front, putting together oncologists, politicians, and also university, the college, the medical college, and also the nurses and the other health technicians to arrive to build up a very important mass of people asking with the patient this to respect the right to be free to treat themselves with the best opportunity of therapy.
Okay, thank you, Dr. Rossi, for that innovative approach. And, you know, if you are hearing everything the panelists are saying and you have some questions, of course, put those into our chat page. Okay, Professor Frost, coming to you now next again. Regarding research programs, now, the draft report by the European Parliament, I'll just quote it here, it calls for sustainable and adequate funding for competitive European research on cancer. It calls for at least a 20% increase in the mobilization of both public and private research on therapeutic and diagnostic cancer innovations. Now, talk to us how you financed your clinical trial. Did you get any public support? And was that then perhaps, or would you say there's a burden then when it comes to research and clinical trials going forward?
May I first add something to the public health system before? Our previous open pragmatic study was now included in the German guidelines for oncological patients. So it is a CAN policy, and maybe this might also influence politicians. Now to your question, our study was not supported by public funds. The main problem is, in general, in all medical fields, the public support in Austria is very small. And if it comes to homeopathy or complementary therapy, it's even smaller. So I was just relying on private sponsors, and without my private sponsors, it would not have been possible to perform this study. And this was especially difficult because I was also forced to finance statistical evaluation by our group. However, this at least made our results even more reliable, because the planning statistician and the evaluating statistician were two different groups, and so there was no influence possible from one to the other group. But we need much more money for funding. Now there's some European health plans, especially in veterinarian homeopathy, because as it's well known, the European Union Health Plan says that animals should be treated primarily by homeopathy, and only if homeopathy does not work, conventional medicine should be used. So I'm very hopeful that research may go into this direction and maybe supported at least by the European Union.
Okay, so Ms. Leclerc, Professor Fraster was talking about a real problem when it comes to money and funding. So can pharmaceuticals, perhaps, like yourselves, like Boiron, fill the funding gap?
Well, of course, we can add our stone to building this huge wall. And I think the first of all, the clinical trial of Professor Frass was really a beautiful study, and the fact that it was fully independent also adds to its quality and relevance. And I would like to say that currently there is really a body of evidence towards the interest of complementary therapies and homeopathy on supportive care in oncology. So, of course, as a pharmaceutical company, we do research and we promote high-level research. First of all, we have our own pipeline with a vast, I would say, array of different methodologies of research. So it includes randomized control trials, like Professor Frass presented us a gold standard example. But also we are trying to focus on some more real-life studies and observational studies that take into account some patient-reported outcomes and that help to understand what's really going on in the real life, which really adds to this very standard clinical trials like Professor Frass introduced us. So many different kind of studies are led right now, including showing a positive perception, more and more positive perceptions of healthcare professionals towards complementary therapies and more specifically homeopathy. Also high satisfactions of patients, because we have to listen to what patients feels and says about that. And this is also a topic for clinical studies. And then, for example, we are currently publishing an observational study at Boiron that was led on nearly 100,000 breast cancer patients to objectivize the benefits of homeopathy on their quality of life. So this is a part of what we can bring, our own research. But of course, we also support some initiatives like integrative oncology centers or initiatives that have their own evaluation methods. And we help finding the right way to evaluate a global integrative oncology approach, as well as evaluate each therapeutical approach and what it can bring to this model. And I think this is really what we need to advance and what we are trying to do. And we work together with researchers and with healthcare professional teams to try to put in place these models that can tomorrow really show the evidence of the benefits of integrative oncology. Although, of course, we already have great examples that have been presented today. So this is what we can do at our level. We cannot completely fill the gaps. Of course, fundings are still cruelly needed in this field, and so far not so much coming from health authorities or national health systems or authorities, unfortunately.
Well, let's hope that companies like yourselves can fill that funding gap, at least just a small part of it. Now, Professor Frass, I'm going to come back to you because Mr. Leclerc obviously was complimenting and saying very good things about, of course, your clinical trial. Now, the results of your clinical trial, they are quite compelling. How do you explain the impact on survival when it comes to complementary homeopathic treatment?
So I think as in all other patients, if you are working with individualized homeopathy, it may help to improve the patient's constitution, or let's say also the patient's life quality. And we all know if we are in a good condition, then we are very strong against all offenses of this life. So with improvement of life quality, this obviously leads also to a prolongation of survival. And there's a study I would like to cite. It has been performed by Dr. Montozzeri some years ago, and he investigated in a meta-analysis several conventional studies, not homeopathic, but conventional studies. And he found in cancer patients that improvement of life quality also improves survival. So I strongly believe that improvement of life quality itself is also responsible for the prolongation of survival. But anyway, whatever, I think survival is one thing. The other thing is already mentioned by Mrs. Leclerc and Mr. Proponents, is that I think it's so important even to improve small problems. Sometimes it's nothing which appears to be very important for conventional medicine, but for the patient and his or her relatives, it's very helpful if even small minor symptoms disappear or improve. So altogether, I think homeopathy helps in any stage of tumors, and therefore I hope that it will become a part of the public health system in the future.
Okay, thank you, Professor Faras. Dr. Rossi, I want you now to jump in and talk about impact survival and the results of your patients. Can you also tell us the approach that you take when it comes to your patients?
Well, first of all, we have a double professional in our clinic. One is me as expert of homeopathy and complementary medicine. The second one is an oncologist that help to interpret and to clarify all the problems from oncological point of view as the patient. The patient are coming from the oncology center of our hospital, but they can come also directly if they want. As I told before, they don't pay the ticket of the visit. They receive a visit and they receive a treatment, which is mainly homeopathic treatment, but not only, depends on the symptoms. And also they receive, we speak a little about this, diet advice, how to try to change the diet of the patient using natural food, reducing white flour, carbohydrates, using less meat, and so on. What we call anti-inflammatory diet for oncological patient, according to some ideas that are a long time spreading in Italy. And then, especially during the chemotherapy session, we advise to make a hypocaloric or maybe sometimes fasting, if it's possible, the day before, the same day, the day after, to reduce the importance of the adverse effect. Then after the visit, the patient received the treatment, but sometimes they advise to go to the acupuncturist if they need, generally alternating with the treatment, the homeopathic treatment. And sometimes they are sent back to the oncologist department because between the different control visits something happened, and they have to be more controlled and checked by their oncologist. And they fix a second control visit, which is generally after 1 or 2 months, depends of the clinical condition of the patient. I want to say two things about what Professor Faras and other people say before. That one is that the research is not very much supported by public institution in Italy, but Tuscany region something made in this sense, because our research about chemobrain and complementary medicine is sustained, founded by Tuscan region, and other two projects about the use of acupuncture in asthenia, fatigue, after radiotherapy, and the other is cannabis for pain, anti-aromatase pain in cancer patient were founded by Tuscany region. And this is a little things, but it's important because is one of the first time that in Italian situation was a public finance of complementary medicine clinical studies.
Okay, thank you, Dr. Rossi. Mr. Billings, I'm going to come to you next and to touch upon what both Dr. Rossi and Professor Frost have been speaking about. So you've got two panelists there who are really talking up the results, especially for survival, using complementary treatment and medicines. So I want to go back to what you talked about a little bit earlier, Mr. Billings, that you said that many patients use complementary therapies without the knowledge of their oncologist simply to avoid pressure. So are cancer specialists really so negative? Why is it that they don't trust this?
That's a good question, because there is a lot of fundamental research conducted in homeopathy, which led to impressive results, excellent studies published. And in the meantime, the skeptics still continue to disregard that evidence. And we remain in a situation where there is an opposition between the pros and the cons. And in the meantime, in between them, there are the patients, you see. And I can assure you, the patient feels that conflict very much. And indeed, a lot of patients simply don't speak about their complementary therapy to their conventional doctor, simply because, well, they don't want to be involved in that conflict. It would be great if the fundamental research that is conducted in complementary therapies was better, how would I say, officialized, better recognized and accepted by the scientific community. There's still a lot to be done, and I think the patients, be it in oncology or whatever other field, they would feel much more comfortable if at last there was some evolution in the mentalities.
Much. Well, it's been great to hear what all of you had to say during this debate. But now we're going to go to the audience comments, suggestions, and questions, and see what they want to ask all of the panelists. Okay, so first of all, and apologies if I do mispronounce your name, we're going to go to the question by Michael van Wassenhoven, and he says, in the frame of patients' free choice of therapy, any healthcare institution must be able to offer a right answer to each patient asking for complementary medicines. If this competence is not available in the institution, then they have to get some external consultancy. And then he says, his question really seems to be, what would be the best way to have integrated medicine inside all healthcare centres, and when will this be possible? Perhaps, Ms. Leclerc, you could go first.
Well, I think that would be the ideal world if complementary and integrative medicine could integrate all these centers. I think we have the chance to see some initiatives in our European countries that are slowly going to make the evidence, the proof of concept, as we say, that this approach is relevant. And hopefully more and more centers will take this as a new model and will build on it. I think this is how it's going to come, organically, naturally, and of course, if any support still is coming from policies and governments, this will accelerate it. So I don't have the answer now to say when this will be a common thing to see integrative care in all private centers or public centers, but we have good hopes that this will come natural way, just like it did in the US, because at the end, this is what patients ask. We have now evidence that it improves patient quality of life. It even improves patient survival. So it means it improves also healthcare system economics. So I think now we have all the evidence, and it's just a matter of putting it into action.
Okay, thank you so much. And I hope that answered your question, Michael. Over to a question by Oana Lacob-Leroy. I'm sorry if I again mispronounced that name. She asks, how do you see integrative oncology in Europe in the future? First of all, let me go to Dr. Rossi, but then I'd also like Professor Fraas to also reply to that question. But first to Dr. Rossi.
I think that really is a growing phenomenon. Is a growing phenomenon due one thing that speaking about integrative oncology, we speak about a complementary treatment which is allied to the oncologist and the anti-cancer treatment, not alternative, not against, but with together. And this can be very useful for the patient, first of all, but also for the oncologist. Just one thing to point out, according to our experience, 10 years ago, we were not at the first stage of our process of integration, but in the middle of this process. A survey made by the public institution told us that people in general, people speak with their medical doctor, family medical doctor, and also their oncologist in the proportion of 67% about their treatment, complementary medicine treatment. It means that if you are integrating, you know each other, and of course there are skeptics everywhere and forever probably, but the most of the family doctors, the most of part of oncologists are in friendship and in agreement with this kind of treatment. The more you integrate, the more you can be in a connection with the oncologist, with the conventional medical doctor. It doesn't mean that the problem is solved, but is important. So in this the perspective, especially in integrative oncology, I see very important evolution. We have in Italy, there was nothing before few years ago, clinical courses, master university, master in different cities. There are open of new clinics. There are about 36, 40 clinics in other part of Italy, included Tuscany, but not only in Tuscany. We were very helped by this federalistic system, so we can have in a small level, the regional level, more possibility to have opportunities than in the national level.
Okay, thank you, Dr. Rossi. And so, Professor Fraas, if you could also answer this question then, how do you see integrative oncology in Europe in the future? A question from Iona Lacob-Leroy.
I'm always optimistic, and I believe that mankind may make progress. And if you look to all the polls and all the surveys in Europe, and I just know one of the latest polls in Germany, at least 80, but even up to 90% of Germans would like to integrate homeopathy and some other complementary therapies into the national health system. And there was also a paper published on parents of children with cancer, and at least 80% wanted to integrate homeopathy into the hospital system. And I think we are just working to convince people and politicians that it is not a problem. In the opposite, it's maybe advantageous for the population to integrate complementary therapy into the national health plan. And this is also something which we have just published a book of the Austrian Association of Holistic Doctors about integrative medicine, emphasizing especially also the scientific part of each method. And the main thing is that we need more presence, of course, in the general media. It's not easy to find a way. We have quite good connections to print media, but we also have to convince television that we can show more presence.
Okay, so we are slowly getting very near to the end. So, Mr. Bouillons, there's a question for you. I'm going to ask you to try to be as concise as possible. And I'll actually direct two questions to you. So there is one from someone called MMRP, nice acronym, and also from Dorita Sebulska. I apologize for my pronunciation there. Okay, so for Mr. Bouillons then, the cost of homeopathic medicine may be cheap, but the practitioner isn't. It takes time and study to find the correct homeopathic remedy for each patient. Homeopathy does not work with standard remedies. Then a follow-up with Dorita. She says, back to Mr. or Mrs. MMRP, that it's not true. Lots of support can be done from clinical homeopathy. I have a good example in my family. So, Mr. Bouillons, what do you make of those comments and questions?
Well, I must say that experience shows that in acute pathologies, the effect of homeopathy can be extremely fast, in a matter of hours. In chronic diseases, indeed, it is much more difficult to find the right remedy, the right medicine. Now, you must understand that the choice of the medicine is based on the interaction between the doctor, the homeopath, and the patient. Not all patients are open and speak up openly, and that can be slowing the whole process of selecting the right medicine. It can be a difficult process. I admit that, and it can discourage some patients, and especially if they're in a hurry to find a solution for their illness or their pathology. Well, that is specific of homeopathy. But once you have found the correct medicine, it can be really impressive, I can tell you.
I'm sure it can be. Okay, well, thank you to everyone who is watching, who has, of course, put in those questions. I hope that you've got the answers that you were looking for. We are, of course, down to the last sort of 5 minutes of our debate. So, may I ask all of our panelists for their final thoughts? And I will go to Ms. Leclerc first, please, if you may. But please do keep it short, about 1 minute, if you can.
Of course, Mariam, thank you. Well, I think this was really amazing to hear all these testimonials today, and it shows that definitely integrative oncology is the future of cancer patient care. Still, some advances needs to be made, especially at European level, where for now there is not so much consideration about this model, and also at national levels by each authorities that need to endorse this model, because now we have the evidence, and we heard today many ways of evidence, the patients' testimonials, the clinical trials, the clinics that put in place this model, everything is positive. And it is such a shame that there is still some difficulty of integration of complementary approaches, such as homeopathy, within healthcare systems. So I hope that this will, working together, private and public institutions, patient associations, healthcare community, will all together make things move towards a more systematic integrative approach. Of course, at Laboratoire Boiron, we will keep raising awareness and supporting initiatives throughout Europe on this beautiful approach. And I really want to thank everyone for their attention.
Thank you so much, Ms. Leclerc. Okay, over to Dr. Rossi. You have about a minute, please. Final thoughts, please.
Oh, yes, Well, I think that I want to encourage a patient and also professional, everybody to use homeopathy and other complementary medicine because they are holistic, centered on the person treatment, efficacy and sustainable as regard the cost, and also green for the environment, and also respective of the different beliefs and culture of people, especially now in a multicultural society. This is important for us, for all the inhabitants of our European country and the world, but also for the young people, because young people are so passionate environment, the global problems of environment can be convinced to use complementary medicine, which are completely in line or in line of their beliefs. So I think that the future is great, but the obstacles to this pathway are numerous and important, very strong. So we need the maximum of unity and connection among our sector, different professionals of our sector, and a very straight alliance with the patient. We are our strength since ever.
Thank you so much, Dr. Rossi. Over to Professor France, your final comment, please.
I look forward that there's more possibilities for students to learn homeopathy, so it becomes a natural source for colleagues, even those who are not working on homeopathy themselves. And I believe that if we have more impact, as just Dr. Rossi just said that we look to the environmental problems, we are just looking to the mass of conventional medicines polluting the environment. I think it's really preserving resources, and it's a smooth method. So I know people like it, population likes it, and we have just to convince politicians and academic colleagues that homeopathy is not frightening anyone. It's just helping, and it's a win-win situation for everyone.
Thank you so much, Professor France. Not frightening, but helping, I should say. Lastly, but not least, Mr. Bulens, over to you.
Well, mainly, I would see two problems that need to be solved, because indeed the situation is evolving in the right direction, slowly, as I said, but still a lot has to be done in the general media to promote integrative oncology and integrative medicine generally, and to go beyond the misconceptions and the ignorance that still prevail about these sectors, these disciplines. This is one point. And the second point that needs to be resolved quite quickly is the lack of young homeopaths. The average age of homeopaths in Belgium is above 60. There are very few young people starting in this discipline, and that will be a problem in a very short lapse of time. So these are the two elements I would conclude with: more attention of the general media and more young homeopaths. Thank you.
Thank you so much, Mr. Bulens. Okay, well, we're going to have to leave it there, but to Mr. Leclerc, Dr. Rossi, Professor Fraas, and Mr. Bulens, thank you so much for being part of this debate. We also thank MEP Dolos Montserrat and Brigitte Sacredeur from the European Committee of the Regions. Thank you for opening our discussion. And of course, to everyone who is watching, I really hope that what you've seen has really given you, you could say, a flavour of the debate surrounding Integrative Oncology. I'm Mariam Zaidi, and you've been watching a debate organised by Boiron with Euractiv as media partner. Take care. Bye-bye.